Wildfire smoke contains tiny particles that can weaken your lungs. Polluted air makes it easier to get sick and harder to recover, says Dr. William Sang. That could mean more severe illness for some.
When you catch the flu, it basically inflames your entire upper airways, right? And even lower airways as well. So it makes it weaker. And when you're weaker, a bacteria can then set in and cause a pneumonia.
Sang says for people with already weakened lungs, the risk is even higher.
If you get a bad lung already, so if you have COPD or pulmonary disease, and then on top of that you get an infection, then absolutely you're more likely for things to settle in.
And even if you've already had the flu, you could still get sick again.
And yes, can you get another virus again? Possibly, but probably from a different strain, meaning you get a different type of flu rather than the same one.
With the flu still spreading, he says prevention is key.
The bottom line, vaccination absolutely has been proven to help. Up to 80% decrease in mortality, 70% decrease in having you ending up in the ICU, and 50% decrease in having to go to the hospital. So vaccines really help, and we're not done with this yet.
To protect your lungs, Sang also recommends limiting smoke exposure and improving indoor air quality.
Putting a HEPA filter in your house, that would be very important. Not smoking is huge. Staying away from smoky environments.
And if you're recovering from the flu, he says even a simple breathing exercise can help.
We do what's called deep breathing. So we kind of pull down our lungs to open up the airways, because when your airways are socked in, you're more likely to get things that get stuck.
His final advice:
Take out that mask if you need to, put it on, protect yourself, because anything, including allergens and fire and smoke, can worsen that and worsen your recovery.
Heidi de Marco, KPBS News.